Good evening, ladies and gentlemen, and welcome to the Ray Tampa podcast. Our podcast offers bold commentary on various subject matters with a laser-like focus on the truth. My name is Ray Tampa, and I'm the host of the Ray Tampa podcast. We have in our studio Mr. Russell Cato, a retired educator of more than 40 plus years of experience in Pinellas County schools. And Mr. Jamie Wilson III, a healthcare provider with more than 25 years of experience working as a physical therapist, my dynamic co-host. Also, we're pleased, very pleased, to have with us Dr. Kanika Tomalin and Mrs. Carolyn Starling Cloud, two women with impeccable credentials and outstanding contributions to our community. They're here to share their comments about our healthcare system in general, and or their specific plans. Dr. Tomlin, Ms. Cloud, welcome to the Ray Tampa podcast.
Thank
Welcome.
you.
Thank you very
Thank you
much.
so
Glad
much
to
for
be
All
here.
right. Well, certainly we appreciate you being here.
Absolutely.
Ladies, I ask that you provide our listeners with a little information about yourselves, such as where were you born, raised, and educated? And I'll ask you, Ms. Starling, to go first.
I'm a native. I was born here at Mercy
Okay.
Hospital in St.
Mercy.
Petersburg, Florida. I was educated in the school system from Wildwood all the way to Gibbs, graduated from Gibbs in 68, St. Pete College. And my parents started Starling School and Daycare.
Mhm.
I left the corporate world and decided I wanted to work for them. And I've been there for 50 years now.
50 years.
Yes.
I know.
All right. Well, I understand you've had quite a few people
Yes.
from our community come through
Yes.
your school,
Very. And
Quite a
I'm
few.
very proud of
one of which is sitting right here.
Jamie, Renee Flowers. I could name
name
several,
them
all that have
Okay,
gone through
great,
Starling.
great.
Yes.
Dr. Tomlin.
I'm Kanika Tomlin, born and raised right here in St. Petersburg, to a very big family, educated here in Pinellas County Schools, Bay Point, Tyrone, and Boca Ciega High School. Went on to study at Florida A&M University, the University of Miami, and Northeastern University in Boston. I'm very honored and privileged to work in my community now, give back to this community that's given so much to me.
Excellent. And we're so proud that you're doing just that. For full transparency disclosure, I asked our guests and several others if they were willing to share their thoughts about our healthcare system. I wanted to get comments from a few locals about the healthcare industry in our country. The horrific and intolerable incident that occurred in New York City early December ignited a tidal wave of emotions, comments, and concerns
Yes.
about our healthcare system. The outrage that resulted is causing many to have renewed appreciation for their healthcare plans and others to have even more disdain for theirs. Dr. Tomlin, please share with our listeners the response you provided me a little more than a week ago when I asked your comments about our healthcare system.
I'll be glad to. To me, healthcare in our country is defined not by its merits and the realities of those who enjoy unfettered access, but instead by the persistent deficits and disparate outcomes experienced by those who find themselves on the industry's margins. America has long held the record as the world's wealthiest nation, as measured by many metrics, but it's far from the healthiest. Every day, that reality deepens as we become a country more vulnerable to the shifting externalities that define quality of life for our people. Inequity and injustice are a predominant determinant of life and health in America, and our ability to engineer systemic solutions that deliver equitable outcomes in everything from income equality to healthcare to housing will be a leading variable in the future position of our nation. World leadership requires national prioritization of people, all people, in ways that recognize and celebrate the dignity and humanity inherent in every person. Our current healthcare system is designed to deliver efficient, cost-effective care to the masses. However, an overwhelming lack of culturally responsive, circumstance-recognizing policies and practice cause us to miss this mark. America spends more on healthcare than most other developed nations and has marginalized outcomes for underrepresented people at levels that rival emerging nations to show for it. We can do better. This can be changed. Inclusive approaches that are people-centered and focused on systemic solutions to deficits that exist within the social determinants of health. That includes access to care, access to quality education, social and community context, economic stability, and our neighborhood and built environment. Changes in those things will pave the way for progress toward healthcare that delivers health quality and health equity for all.
Excellent, excellent, excellent. And what we're going to do, we're going to ask Miss Starling Cloud to do the same, share her comments that she tendered to me a little while ago. And when she finishes, then we'll discuss what we heard. Ms. Cloud.
Thank you. Healthcare is a fundamental component of society's well-being, encompassing a wide range of service systems and practices aimed at maintaining and improving the health of individuals and communities. Healthcare has been essential to my family and in my life. I have found that education and knowledge of the system is vital. Knowledge is knowing your family history, and education is learning about your illness and how to manage it. As a breast cancer survivor, an autoimmune disease survivor, and a family of hypertension and glaucoma, I have always found that I needed to educate myself on what was the best treatment options and services for me. If a doctor did not listen to me and could not communicate me in simple, understandable terms, I would find a new doctor. I also learned from my brother Thaddeus that university clinics and doctors were very informed because of the research money given to them to cure and study diseases. I can't say I have always been assured, but even then I still found excellent doctors who would work with me. Not having insurance, now having insurance, I make sure that I'm able to seek out doctors and specialists who will listen to me and meet my needs. But I know this is not always true for everyone, even members of my own family. The recent healthcare headlines have brought healthcare to our attention, and we must know the future of our healthcare system. Our healthcare system does need reforming. The high cost of medicine, coupled with disparities in access and quality, necessitate a comprehensive overhaul to ensure a more equitable system. I believe that a nation that does not support healthcare for all is doomed to fail. We must keep communicating our needs and demands. We should not have to choose between eating and affording our medicine. Our future depends on it.
Wow. We just listened to two very profound statements about our healthcare system in this country. Now we want to talk about some of the things we just heard. Dr. Tomalin, you offered us a definition of healthcare, stating that healthcare should not be defined by the unfettered access of those who can afford it, et cetera, et cetera. It should be defined as well by those on the margins.
Absolutely.
How about elaborating a little more on that?
Sure. Any system that governs quality of life and the way that we move through society must be defined by the least, the most vulnerable among us. Many of us are very fortunate to have means and access to be able to navigate the complexities of the healthcare system. But we will only thrive as a nation, as a people, as a community when the most vulnerable among us are able to get access to the resources that they need in a way that includes and ensures their dignity and recognizes the inherent value that every person brings to the journey of life.
Excellent. One more thing with you, Dr. Tomlin, if you don't mind. You mentioned that our nation's wealth does not equate to superior health care, something to that effect.
Yes.
We're the wealthiest country, but we're not the healthiest country.
Yes. And that's
Talk-
a choice.
Okay.
That's a choice that our nation has made throughout the history of this nation. We have a sick care system as opposed to a healthcare system that is focused on preventative measures and means that allow us to remain healthy, allow us to provide for our family and our community in ways that allow us to thrive. Instead, we focus all of our resources toward very expensive, not necessarily the most effective means for people once they become sick. And the people who are most sick are often not able to access those measures that they need. So we are a nation that can do great and mighty things. We do it every day. And we can absolutely decide that healthcare in this nation is a right. And by virtue of being an American, by virtue of living in this nation, you will get access to the care that you need to thrive.
Awesome. Awesome.
I want to add to that. When I
Okay.
traveled to Sweden, they have the most comprehensive healthcare system. Everyone in Sweden has access to healthcare. And America ranks last in healthcare as providing for our citizens. And to be the wealthiest country, and then when you see a small country like Sweden offering healthcare and it's paid for by the citizens, and this is what's on the idea of Obamacare, but we don't want it.
It's a matter of prioritization.
Right. So it's just really sad.
I'm glad you cut in with that comment because the two of you are world travelers. I think Carolyn has been everywhere on the globe.
Not exactly.
And if not everywhere, almost everywhere. And
Breast
Dr.
cancer.
Tomlin, you've done your share of traveling. So that was a good comment, good cut in. But I want to go to some things you said as well in your presentation. You mentioned education and knowledge of the system, healthcare system, is very important. And what you were alluding to is that the patients need to participate in their health care. You stressed that.
You have to. I can remember when encyclopedias were sold door to door, and my mother would always purchase a set. And one year with that set came a medical book. And we would read it over and over again. And that's when I became knowledgeable about different diseases and illness. And then as my parents grew older and I became a healthcare provider for my father and my mother, and I really delved in their history. And that's when I knew that I had to be educated about what they were experiencing, because eventually I was going to experience the same illnesses. Hypertension ran rampant in my father's family. Glaucoma, my father went blind. I've had glaucoma surgery. I take drops now, but I have to be educated about glaucoma. When I had my surgery, I went on YouTube and saw how he was going to do the surgery. So we do have to participate. You cannot just sit there and let them just tell you. And you know your body better than the doctors. So this is why you have to communicate with them, and you need to also let them know what you're experiencing so they can better treat you.
That's awesome. Thanks a lot. Do either of you want to say anything at this point? Russ,
I feel
Jamie?
with the healthcare system, education is important, and I know genetics are involved, but we eat terribly over here. And in other countries, our food is so bad that they don't even allow our diets in other countries. So it starts with that, but also knowing the system, like you said, knowing the system, check behind your doctors. I have patients 80, they get on their computers and they're diagnosed. They get in there and they educate themselves about the medicines, the symptoms. You know, you got to get involved, all ages. You're right. You really got to get involved in your care. And if you're not treated right, switch. I tell them all the time, get a new doctor.
Right.
And I'm glad to hear Jamie say that because as I indicated in the opening statement, Jamie is a healthcare provider. Jamie's wife is a nurse practitioner, one step below being a doctor. Jamie's son, nurse practitioner. Jamie is 2 or 3 classes away from nurse practitioner, heavily involved, his family, in the healthcare system. And so I appreciate those comments thoroughly. Russ, you want to say anything?
Yeah, I'm always looking at, and I talked to Jamie about this, it's why the healthcare system is failing. And you have to go back in history to look at that. And I'm going to take a little bit of time and tell you this. America does not want to be called a socialized nation. They do not want. The word socialism in America reflects to the word communism in America. Now, let me go back to you. This country spends more money than any country in the world on health care, but they last in performance. Why? Let's ask yourself, there's a reason. You've got to look at the objective of this country. The objective of this country is profit. Profit over health care. If you look at all the industrialized nations, Sweden, these people have universal health care. The United States is the only nation industrialized don't have universal health care.
Right.
There's a reason for that. If the government would control health care, there will be some people in this country saying that you are taking socialized medicine. They do not like that word socialized medicine. If you go back and look at every other country, they have socialized medicine. It's called universal medicine. In other words, the government controls the program. That's what it is. Over here, private people control the program. It is money that dictates our health care. And I don't see it changing. I really don't. The way this country is set up, if you look at what this country is supposed to do as a nation to protect the health and the welfare of people, it is out there for them to do it. But they're not going to do this.
Not profitable.
And they don't want to do it, Jamie, and they won't want to do it.
Profitable treat.
You know, I'm coming off eye surgery this week. And as I walked into the hospital, I was lucky that I have insurance to cover this.
Right.
Thank God for Obamacare. You see, this is something that the Republicans saying we're going to get rid of. They ain't getting rid of Obamacare because they got too many damn white people on Obamacare.
Right.
Their people. So, you know, damn well they ain't getting rid of Obamacare. I don't care what they say, they're coming in. But I don't see them saying a universal control. I just don't see America. I don't see the United States accepting this because it's not in their blood to accept this change. Right. It's not going to do it.
And this is an issue of particular importance to communities of color
They're not going
and
to do
people
it.
of color, because even as people of color, and this is statistically proven, enjoy access to
Sure
healthcare,
is,
even as they
sure.
are insured.
Sure.
Uh, Black people in America cannot out-educate, they cannot out-earn the health disparities that they
No.
experience.
No.
We recently, I'm the president and CEO of the Foundation for a Healthy St. Petersburg.
Yes. Yes.
We recently did a health disparity study in our own community to see which disparities were plaguing our community, if at all. We want to be evidence-informed in our approach. We found that chronic disease,
Yes.
white people all in our community have chronic disease, Black people die from it. Risk of early death, much higher for Black people than white people. Injury and violence, and the result of injury and violence on life, much higher for Black people than white people. And maternal fetal medicine and outcome, the likelihood that a mother will die in childbirth or a baby will live through childbirth, much different for Black people than white people, regardless of income, regardless of geography, regardless of education. And that is historically and statistically and significantly rooted in a history of racism in this nation.
Yes.
So
Exactly.
when we look at healthcare as a community of color, we have to be advocates, armed
Right.
with the education
Mhm.
required to be in partnership with our healthcare providers and ensure that we are receiving the access to the care that we have, that we need, and that we are receiving culturally responsive care that attends to the specific needs of our community.
Awesome. Carolyn, you wanted
Sure.
to say something?
Well, it's when I went to Moffitt and found out that most Black women die from breast cancer. And when I go over there, and basically I'm almost the only
Yeah.
Black
Yeah.
being treated over there. But I also found my cancer in stage 1 because breast self-examination. I didn't depend on a mammogram. I missed my mammogram
Yes.
from taking care of my dad.
Yes.
But I still took care of my body.
Yes.
So I did that. And I decided to go to Moffitt, and I received excellent care over there.
True.
And when I looked around, I saw people of all financial, I
Yeah.
mean, rich, and I'm sitting there and crying, but I'm almost the only Black one in
Truly.
there.
Truly.
And then when I get back to St. Pete, members of my church and dying from breast cancer.
Yeah.
And when I go to radiation and I say, why? And the lady I sat next to and had radiation with, she died 2 weeks after. I called panicking, thinking I'm finna die the next day. And I'm 15 years out now, being cured, a survivor. But it was because she waited too long. And she had the means, but sometimes fear
Mhm.
make us not want to take care of ourselves. Fear, and when fear of the word cancer, fear of the word hypertension, fear of the word glaucoma. And if we don't educate ourselves and do a lot of preventive, and like Jamie said, our diets and what we eat, we don't take supplements, and now doctors are even pushing that. But we have to educate ourselves, and we have to listen to our body. We're going to have to, even though we're dying more, but you're going to have to take care of yourself and demand that a doctor, when that lump is there, demand that, okay, I'm only 35. I had a
Yeah.
friend who's only 35, and the doctor told her, you're too young. But I said, no, go to Moffitt.
Right.
And she had breast cancer. So you have to demand care sometimes
Mhm.
and
Excellent.
demand these doctors treat you.
Can I say this when
Go
you
ahead.
say demand? I have a son who is in a mental state now, mental health. And when you use that word demand, when he was arrested, they wanted to arrest him as a criminal. We have to demand that this man is not a criminal. He has a mental health problem.
Right.
We had to fight that. Because if we didn't fight that, because many Black people don't fight that
No, they
when they say mental health, we had to get a lawyer. And this kid been in jail for 2 weeks, 3 weeks. And it wasn't for a lawyer to put a mental health case on in his behalf, he'd have been in jail today.
Mhm.
So we have to demand things. So I'm
Yes.
glad that you used that word.
right.
Thank you.
Mhm. So important.
Yes.
I want to share some personal information as well.
Yeah.
Since I'm hearing some personal information, I go to the doctors.
Mhm.
I go to all the doctors regularly. Eye doctor,
Oh,
urologist, cardiologist,
Yes.
whatever. I go to the doctors. My urologist found some concerns that suggested further investigation, which turned out to be prostate cancer. And when she said that, it came out of my mouth, cut it out, meaning get rid of it, cut it out. Because I witnessed my brother, his slow death
Mm.
as a result of prostate cancer. And my brother was 6'4", 240 pounds, big. But when he died, I'm sitting next to him at hospice,
Mm.
skin and bones. I did not want to go through that. So thank God, because I go to doctors, we caught it early. That's the key.
Early is the key.
Early detection.
Early detection.
And you get early detection from going to the doctors. And when my doctor said Red's cancer, she didn't say it so coldly like that, but she followed up her statement with, we're going to take care of you. And I'm here to say they took care of me.
Thank God.
They took care of me.
I'm a survivor of prostate cancer.
Yeah, and we did that show about
Yeah.
prostate
Yeah.
cancer. Excellent show.
Yeah.
But when you all presented your statements to me, and you read your statements, I started doing some research, and there's an article that was published by the Harvard Health Publishing Company. They're affiliated with Harvard Medical School, and they wrote this article, and the title of the article is "Our Healthcare System Broken?"
Mm.
Definitely true.
And they were saying what you all were saying
Definitely true.
in this article that was
Yeah.
published in 2021, July 13, 2021.
Yeah.
I went to another article published by the Nashville Healthcare Council. They're very prominent in the healthcare industry.
Mhm.
$98 billion involved in the work they do. They wrote similar things to what you two said. And I have that article here as well. It's entitled Identifying Challenges Facing the United States Healthcare System. Identifying challenges, and you all identified them. Then I picked up an article by the Tampa Bay Times. United Healthcare and other insurers accused of denying claims.
I saw that.
This article specifically states that their adjusters were
Yeah.
denying claims
Yeah.
right and left. Deny, deny, deny.
And you're the evidence of
Right.
the importance of claims and early detection.
Right.
Yes.
And now they're using AI bot to make those decisions. But as individuals, we got to be responsible. We got to take some responsibility because we know it's disparities in the system.
Correct.
We know this, but we have to make better choices with our food. Just because your mom and dad got high blood pressure, you might not get it if you eat right and take care of yourself.
Right.
You have to be responsible. I see a lot of that. And there are disparities. In physical therapy, I go to the hospital. I have patients in hospitals. I go to their homes. We are treated different. We're treated different.
Okay. Well, 30 minutes goes by fast.
Wow.
30 minutes.
Yes.
And
Too
Don is
fast.
telling us it's time to wrap it up. And with that being said, I want to thank our guests
Thank
for
you.
being here.
Thank you very
I
much.
really appreciate what you all have offered on the subject.
Great.
I want to thank my two co-hosts, dynamic co-hosts, for a job well done. As always, I want to thank you, the listeners, for tuning in to the Ray Tampa podcast on 99.1 FM the bird, and ask that you do so each and every Tuesday, 5:30 p.m. And with all that being said, good evening.
Good.